Today is Tuesday, November 10, 2020, and we are going to be covering Module 1A on Semen Analysis. My name is Ashok Agarwal. I am the host of this program for the next 2 hours. So welcome to all of you, and we are ready to begin now. I want to declare that we don't have any conflict of interest. As you can see, the program was completely organized by the support from our center, and no companies or outside entities were contacted for any kind of sponsorship. Webcasting was supported by our Cleveland Clinic IT division, David Reichling and David Wolfley. Course faculty have donated their time for this online training. Program coordinators, and we have 7 of them who have volunteered their time for this training. And more importantly, the names, images, and description of certain products or instruments which you will see during the lectures are being used routinely in our andrology lab, and we are not endorsing any of these as speakers. So today's program is going to be including Module 1A, which is Manual Semen Analysis, which you have seen in the announcements that we have provided you. I am in charge of the andrology program at Cleveland Clinic, and I'm also the director of the American Center for Reproductive Medicine. I wear a couple of different hats. I am very much involved in managing the diagnostic lab of the Cleveland Clinic, as well as our program in male infertility research in Cleveland Clinic. We are recognized as the #1 program in the world in the fields of male infertility, andrology, and human-assisted reproduction. And this is based on the number of peer-reviewed publications, based on the number of citation scores that we have, and also based on the H-index. And these are the numbers that anybody can check anywhere in the world. If you go into Scopus database that rates every single researcher or author in the world. We have a large number of medical textbooks that we have written. More importantly, our program has trained over 1,000 scientists, clinicians, undergraduate students from the United States and from all over the world. So I'm very fortunate to be running this program along with the very talented team of people who you will meet some of them today. I spent about 10 years at Harvard Medical School, where I was the director of male infertility research in urology at Brigham and Women's, and also an assistant professor at Harvard Medical School. So now let's talk about the program. That is enough of my introduction. Okay.
So, good morning, everyone, and welcome back once again. So I'm going to take it to the next level and talk about quality assurance in an andrology lab. And then the proficiency testing will be covered by the next speaker. Next slide, please. Learning objectives of my presentation are difference between quality control and quality assurance, implementing quality assurance within the andrology lab, quality assurance and its role in maintaining the lab accreditation, and what are the components of quality assurance. So this also applies on the right side. There is a depiction of the quality assurance cycle. It does apply to all 3 phases of testing, including pre-testing, testing, and post-testing. Next slide. So quality assurance in an andrology lab can be described as a systematic program that monitors and evaluates the quality of services which is provided to infertile couples and their treating clinicians. And there is a purpose for quality assurance in the laboratory as well as a need. So the purpose is to provide reliable and efficient services of the lab, maintaining the highest quality and complying with regulatory requirements. And the need is that it is required by accreditation, CAP, and FDA, and ultimately produces results that have applicable diagnostic, health, and healthcare decisions. Next slide. So what are the essential differences between quality control and quality assurance? So on the left are the descriptions for quality control. I would like you to note at this point that quality control activities do not measure the laboratory performance as a whole. Quality control treats each element as a unit, whereas quality assurance, on the other hand, is the overall surveillance of all laboratory activities related to quality. It includes measuring the entire testing process. It includes monitoring the outcomes. It includes reporting accurate results and assessment of feedback from patients and the various personnel. So the bottom line is quality control is a part of quality assurance. Next slide. How do we implement the quality assurance program within the Andrology lab? So we have certain defined objectives. The quality control plan, quality assurance plan is defined to organize and monitor the processes and procedures within the lab and identify any problems or errors and document them, as well as perform a review of these errors or deviations that have happened within the lab. And this is an ongoing review which involves the pre-analytical, analytical, and post-analytical phases. So within our laboratory, we have a review that we conduct by doing self-assessment audits. So as part of the self-assessment audits, we have a QA weekly report audit, wherein the patient worksheets are picked up at random, and these are reviewed for errors, and then these errors are documented. And I will provide an example as we go further in my presentation. We also have a monthly quality assurance or quality improvement review report, which is a comprehensive review of the test results, the sperm inventory checks, the test turnaround times, and also review of the incident reports. Next slide. Next slide. So this is an example of documenting errors, and this is an actual worksheet from a test that has been done in the Andrology lab at the Cleveland Clinic, and this is reviewed, checked for any errors, checked for calculation errors, and once everything is checked and documented, the supervisor will sign off, as you can see on the right upper hand of this sheet. Next. And then checking of the electronic medical records, which is shown over here, printed from the Epic systems, and all of the results have been checked and documented. Next. So here I provided an error report. This is a weekly report that has been done, and the days when there were no errors, it has been documented, the type of the test conducted, there is a description of the test, and whenever there is an error, you can see in row 4, there was an error in the pre-wash calculations, and this was documented. And the correction of the error is also documented. So this is a weekly audit that we do as part of quality assurance. Next. Any incident or accident or error or deviation is recorded as a lab occurrence report. This is part of our quality assurance. So this is a very detailed form which looks at the pre-examination, examination, and post-examination phase. And here, the factual description of the incident, you can look at the lower box, and it provides that the IUI process was canceled because of lack of enough number of motile sperm, as observed in the wet prep. Next. So this is the second part of the occurrence report. What was the corrective action taken? The incident was reported to the reproductive endocrinologist, and then she informed that the sample should not be processed because of the low numbers. And then she counseled the patient and informed him because the sample was rejected and the procedure was not carried out. And then finally, we also have tick mark in the box as showing that this incidence was corrected, the date of correction, and then this is reviewed by the supervisor and the director. Next. We also have for the instruments, any incident or deviation in the instrument quality indicators is documented as an instrument maintenance report, including all details of the instrument and what was the problem. So here we have a problem with one of the pipette guns, which was not charging, and then the supervisor contacted the clinical engineer, and then he examined the machine and recommended it sending to the manufacturer. Next slide. So here we have shown that the manufacturer was unable to repair, and then we had to trade in for a new instrument. So instrument problems are documented and the resolution is documented in this report. Next. So this is the overall quality assurance report, which is prepared for all the processes within the lab. It includes the IUI sperm prep reviews, the sperm cryopreservation reviews, and also performing frozen sperm samples inventory check. I just want to provide one example to, you can examine the IUI sperm prep in the top box, which gives the threshold for recovery rate as greater than 10%. So all of the 3 samples that were processed within our lab met this criteria. If the criteria are not met, then we document it and go back and look at what the root cause was of the poor recovery rate and provide a resolution. Next. So this is continuation of the QA report, and this shows the turnaround times. And here, one of the turnaround times was not met because the threshold was 3 to 5 days, and it is 8 days. And then we went back and investigated why this happened. Next. So this is documented, the problem area is identified. The correction was that the semen analysis results were entered and submitted in the system. And then we went back and looked at several other tests that were performed to look, to examine if the turnaround times were higher, and these were within the expected range. And this was a random incidence. So basically, we looked at all the processes, made sure this was not happening repeatedly, and provided a resolution. Next. So quality management report is an integration of all the processes within the lab. It includes quality control reviews, quality assurance reviews, error reporting, any specimen rejections, the proficiency, and the competency. So this is a more wholesome review of all of the services that we are providing within the lab, and this is prepared by one of the supervisors, and any deviations or non-conformities are documented. Here, there was no deviation, and then this is finally reviewed by the director and signed off. Next. Quality assurance is important for maintaining the lab accreditation, and this is per the Code of Federal Regulations, which is the FDA. They require that the lab follow the written policies and procedures for a comprehensive QA program, and it is designed for an ongoing assessment. And this also is a requirement on the right side. You would see, as per the Clinical Laboratory Improvement Act of CLIA, which includes these 2 regulations per the federal regulations, also includes looking at the test results, staff competency, and documenting all the quality assurance activities. Because whatever is not documented is not performed. And then the CLIA designates the College of American Pathologists to come and inspect the labs and look at all the documentation. And once they are satisfied, they will accredit the lab. Next slide, please. So these are the standards per the CLIA. On the right side, the 10 standards are provided by CLIA, and which are part of the quality assurance plan which the lab implements. And each laboratory implements this QA program based upon patient test management, quality control, and all of the other pillars which I have explained in my talk earlier. Next slide. So the take-home message is the main objective for implementation of a quality assurance program is to maintain, document, and review any problems that may occur in the andrology laboratory, not limited to just the test problems, but even any complaints or patient feedback, as well as the physician feedback. And this is important for the labs to stay compliant. And each lab can actually have a QA review committee. And this quality assurance reports that are generated can be reviewed based upon the available information. And then any problems can be researched and solutions can be provided by the laboratory staff and suggest actions to be taken to maintain and improve as well as achieve high standards of performance and service in the andrology laboratory. Next slide. So now the next part of the presentation will be done by Dr. Sharma. He's going to be speaking about proficiency testing in the andrology lab.
Next slide, please.
Courtney will not be here today. I mean, she is here, but she is busy with taking care of some of the patients in our other lab because of the shortness, because several of the staff, employees have some family issues. So don't think Courtney is a very beautiful woman, but the next speaker is not Courtney Sharma. So please don't be confused with that. All right, Rakesh.
Thank you, Dr. Agwal. So I'm going to cover the proficiency testing, and Dr. Gupta has covered in detail the quality control, the quality assurance, and the last section is proficiency testing. So the objectives I will cover is some of the principles of proficiency testing, why participate in such a testing program, and the analyze that our andrology lab participates, and then some key takeaway points. Next slide, please. Next slide, please. So as the name suggests, proficiency testing. So I want to draw your attention, proficiency, as the name suggests, is do you have the skill or the ability or the expertise to conduct the tests that are offered to the patient? In other words, is the laboratory technologist proficient or capable or skilled to conduct the test? And that is, in simple terms, the proficiency testing. And the objective is to have a test which is reliable and we can validate the testing process. And the accreditation agencies such as CAP or the College of American Pathologists conducts this proficiency testing semi-annually, and the lab will order the survey material or the test material based on the test that they conduct. And in our andrology lab, we perform the sperm concentration, we perform the sperm motility, morphology, the vitality, and the antibodies. So those are the survey material that we will order from the testing agency. The survey material is received twice a year, and the lab will designate a person or a technologist to conduct the test, and the test results are then reported to the testing agency, which will then provide us the review or the report of the proficiency testing, as you can see on the image onto your right. And based on that, we will be informed whether the person who conducted the test has passed those analytes and the lab is good for the proficiency testing for that duration of time. Next slide, please. So some of the principles of proficiency testing that we should keep in mind is number one, there is no laboratory communication. And if the lab has multiple labs around the city, then they cannot communicate those results within their lab as well as in other labs. The communication of the result is strictly prohibited, and the survey material is analyzed as we would analyze a regular patient sample. And in our andrology setting, we designate one technologist who analyzes all the analytes or all the survey material obtained from the proficiency testing agency. The results cannot be discussed with the other lab personnel before the material is sent to the testing agency. And once the results are obtained, these results are discussed among the lab employees, and if a corrective action is required, then that is implemented. All the results from the survey material must fall within the mean on 2 standard deviation. On to your right, to see a picture of our team looking at the semen analysis. Next slide, please. So our lab orders the analytes, which I mentioned are the sperm concentration, and the testing agency will provide us 2 analytes, and generally they are the low and high concentration of sperm. We load the sample onto the sperm counting chamber, and the 6 microliter sample is loaded, as I explained in my earlier presentation. And the testing method that is reported is the fixed cell concentration method. And these results are reported to the agency, whether the sperm were present in that particular analyte or they were absent. And the results should be within 2 standard deviations of the established results by the testing agency. Next slide, please. The other analyte that we order is the sperm motility. So the testing agency provides us access to the video clips, and these are online links. We examine the 2 analytes. They could be low motility and the high motility. And we also report the percent motility, as well as we calculate the forward progression when we're reporting the results back to the testing agency. Next slide, please. In addition, the other analytes are also tested, as I mentioned, the vitality or the morphology or the antibodies. And all these results are then compiled by the testing agency, and we will receive the results, as you can see in the box onto your right. And the results of the lab that provided the analyte results are indicated. Also, the results of our testing are provided with the mean and the standard deviation. We also are informed of the number of participating labs, and it also provides information whether the lab has passed that particular analyte. In many cases, the testing agency will report a value of 26 as a grade. And what this means is that the results are not indicated in the result by the testing agency as pass or fail, but this is reviewed by the lab director. And if the results are acceptable, then each technologist will sign off, and that indicates that the lab has passed the proficiency testing. Next slide, please. So the take-home message from the proficiency testing is that in order for the lab to be certified or accredited, we are required to participate in the proficiency testing, and this is done twice a year. And the analytes that are ordered are based on the tests that are conducted. The number of tests that we are conducting are the defining criteria of the analytes that we will request from the testing agency. And if the results are within 2 standard deviation, then no further action is required, and the lab has passed the proficiency testing. In situations where the particular analyte may not fall in the acceptable category, then the remedial measures are in place. And if the repeated failures are noticed, then the lab must stop testing. So to sum it up, proficiency testing is very important and a part of the quality control and quality assurance, which provides the confidence in the test results that are provided by the lab to the patient as well as to the physician. Next slide, please. This is a group, again, looking at some of the setup of the semen analysis in a micromanipulator. Next slide, please. Thank you very much for your attention. And this is a beautiful sunny day showing one of our Cleveland Clinic buildings. Thank you again.
Thank you very much, Rakesh, for your presentation. And you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ACRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.